Prostate health is a critical issue that affects millions of men, but for Black men, the stakes are particularly high. With a significantly increased risk of developing prostate cancer and facing disparities in diagnosis and treatment, it's a health concern that demands attention and action. Today, I'm joined by Dr. Paul Yonover, a leading urologist and the practice manager for UroPartners, to discuss what Black men need to know about their prostate health, the importance of early education, and how we can work to close the gaps in care. Welcome, Dr. Yonover. Nice to see you.
Very, very nice to see you.
Thank you for being here.
Yeah, it's my pleasure.
First of all, let's just clarify for my watchers, what is a urologist?
Well, it's a great question. Many people don't know what a urologist is until they need one. We are surgeons and medical doctors who treat the genitourinary tract. So that's the kidneys, ureters, bladder, the prostate, testicles. We deal with all things that involve the urinary system, kidney cancer, bladder cancer, prostate cancer, which we're going to talk about today, urination issues, kidney stones, and a host of other things. But a lot of our work, for most general urologists like myself, we deal with urinary issues, and the bladder and the prostate are intimately related. So for men, urinary issues and prostate cancer, while not completely related, are very much overlapped.
Right.
So when people talk about prostate health, they really are talking about two different things, both the size of the prostate and the ability to eliminate urine and store urine by the bladder. And then, of course, prostate cancer is a cancer that's found within that gland. And that's what urologists both treat that health and they screen for those tumors.
So I think everybody kind of knows what their bladder is. They've heard of a kidney. Mm-hmm. They may not really get what the prostate is or where it is or how it works or how does it affect their bladder and using the things that they need to use.
Sure. Well, I'm not afraid to admit that I didn't know what a prostate was or where it was until I got to medical school. So it's an organ that is I brought a model with me, but it's an organ that sits at the outlet of the bladder. So here's the bladder, and here's the rectum. The prostate is here, and the only purpose of the prostate is for fertility. That's all it's there for. But because it's positioned outside the bladder, urine has to flow through the prostate. So it does impact urination. And in fact, the way that men are able to hold onto the urine is also controlled by the prostate. When men get assessed for prostate cancer and have their prostate felt, the reason why we have to do a rectal exam is because there's an intimate relationship between the rectum and the prostate. Oh. And so that's important for men to understand, is that's why, and this is a very high traffic area right in the pelvis, and that's why, that's how we have to access the prostate for screening purposes.
Wow. Well, that clearly makes a big difference.
Right.
Who knew? But why is this such an issue for Black men? Why are they at increased risk? And are there things that Black men can do to reduce their risk of prostate cancer?
Well, unfortunately, prostate cancer is one of those cancers where we can't really have a huge impact on the incidence from behavioral modification. Mm-hmm. A lot of cancers, lung cancer, bladder cancer, and other cancers, smoking modification, dietary modification, can make a big impact. Prostate cancer, there's not too much you can do from your lifestyle. There are things. Better eating, don't smoke, lose weight, exercise. Those are all very good. But the actual incidence of prostate cancer is higher in Black men. We've known that for a long time. Why? We're not exactly sure. But scientists have sort of unraveled, it's mostly genetic factors, not environmental factors. So Black men, particularly Black men from Western Africa, Eastern Africa descent typically doesn't have the same genetic risk factors. But if you're from of West African descent and you've come to the United States, you have almost a 1.7 times risk than your average Caucasian. Wow. That's driven by molecular and genetic issues. Where the problems we face in modern American medicine, particularly vis-a-vis Black men, those men who are already at much higher risk of having the cancer aren't getting the screening. Right. There's lots of reasons why they're not getting screening: medical literacy, barriers to care, insurance issues, perceptions, mistrust of the medical system, well-deserved mistrust, misunderstanding, understanding the difference between colon cancer screening, prostate cancer screening. These are all the barriers that we face, and that as a medical community, it's on us to help break those barriers down. The black men, though, are at higher risk of having the cancer. Once we find the cancer in those men, they have worse outcomes. The risk of death from prostate cancer is 2.5 times that of a Caucasian, and that isn't because of tumor biology. That's because of poor access to care. They're being diagnosed at a later stage, and they aren't afforded sometimes the cutting edge things that we have to offer, and that's where there's even a title of a.
I was just going to say, you told me about an article you read.
Yeah, there's I think the title says really it all, which is racism doesn't cause prostate cancer, but racism causes prostate cancer death.
Wow.
It's a very powerful message, and I think it's one that the medical community has to internalize, and we need to do something about.
Right, it matters because it is very treatable, prostate cancer, when caught early. Is that right?
That's exactly right, and that's where the irony of all of this is the population that benefits the most from screening are black men.
Right.
So if you have black men between the ages of 40 and 75 who are healthy, if we can screen them appropriately, we can find the disease early, and only for those men who have aggressive disease do they need curative treatment, and if they do, they can be cured.
Right.
So a lot of prostate cancer death is avoidable.
It's preventable. Wow. So powerful. I wish, as I told you when we started, this is going to go fast. We run out of time on this really important topic, but thank you. Thank you for taking the time to come here and educate my audience around this issue because it's so important. So if you're listening and you're a black man or there's a black man in your life that you care about, I hope you heard what he said. Get screened for prostate cancer. Dr. Yonover, thank you so much for being here. I really appreciate you.
It's my pleasure. Thank you very much.
Thank you. We'll be right back on the other side of this short break. We'll continue this critical conversation when I'll be joined by Cook County Commissioner Bill Lowry discussing his personal prostate cancer journey and what Cook County is doing to help men and women take fuller control of their health. Stay with us.